This is VOA Africa. Hello, I'm Vincent Makori, Africa 54 Managing Editor. Welcome to this special edition of Africa 54. Now, due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at the VOA headquarters here in Washington. We are working to help keep you informed about what's going on, and we appreciate you are staying with us on Africa 54. Well, seizing the moment. A new report by UNAIDS notes that progress made in the fight against HIV and AIDS could experience a setback due to the COVID-19 pandemic. Africa 54 health correspondent Lino Mudu interviewed UNAIDS Executive Director Winnie Byanyima. They discussed the impacts of COVID-19 on the fight against HIV and AIDS and what can be done.
Now, a lot of progress has been made over the years, and as you mentioned, when it comes to addressing HIV/AIDS on the continent, one such progress has been prevention of mother-to-child transmission, not only in Africa but also in other parts of the world. There has been progress on that front. Yet, Nigeria has one of the highest rates of mother-to-child transmission in the world. So, what can be done in Nigeria particularly?
You're so right. Some countries like small islands in the Caribbean, like Jamaica and others, have already eradicated mother-to-child transmission because the treatments are there that a mother can take to prevent her from passing it to her baby. But Nigeria and a number of other countries, not only Nigeria, are actually seeing reversals, are losing the ground on that. And why? We know why. It's mothers who don't come for antenatal and postnatal. So there are reasons, and they are very well researched, why many women don't come. Sometimes the service is too far away. Sometimes there are user fees. In this part of West Africa, user fees are stopping women from going to clinics. Do you know that in some countries, you have women being arrested after they've had their baby? They are held prisoners in the clinic until somebody goes and sells their piece of land or something to come and pay for being in the hospital to deliver a baby. That is how user fees are. They are violating human rights, and they are ridiculous because while you're keeping her in the hospital, someone who needs the bed is not getting it, as you are trying to extort money from a poor person. Then you also have women who actually come, are put on treatment, but then fall out of care. There are also many reasons we have researched them why women and men even fail to stay on treatment. Very often the service is provided in ways that are so inconvenient, too far away. You go there, you line up for a whole day, you've got to earn food for your children, you've left them at home, or you go there and they say they stock out, come back next week, come back the other day. Many things about services not being close enough and in ways that are accessible. Then there are also issues of hiding. Let's face it, many women are blamed for carrying the virus by their husbands. They keep it a secret.
Now, let's talk about innovations because, of course, doing the same thing over and over again may breed results, but it's important to come up with new ideas, new solutions. So what type of innovations is UNAIDS promoting or pushing for?
We work with scientists to spur innovations in science. That's one area. And like I've said, we still don't have a vaccine, we still don't have a cure. So we still are pushing companies, research institutions, universities to continue looking for a vaccine, but treatments. We have some treatments that are keeping people well, but there are gaps here and there. For example, we need better and better treatments for children. If you are a child and you are positive, your mother passed it to you, you're going to be on a tablet for the rest of your life. Think about a little girl of 6, 7, 8, 10, 12, keeping a secret about her tablet because she fears her peers. She would be better off if they would say an injection that she can have once in 6 months, but not hide every day to swallow a tablet. So better treatments that suit people where they are. The same with how young men don't want to go to clinics to test. We are now moving towards self-testing and even receiving your antiretroviral tablets at an ATM in a mall rather than to line up at a clinic. We need more innovations on prevention. We need more and more clever ways to change behavior, attitudes that are harmful and that encourage infection. So we need more innovations across the board.
Well, that was Africa 54 health correspondent Lino Mudu speaking with UNAIDS Executive Director Winnie Byanyima. Well, the COVID-19 vaccine trial in South Africa has been subject to some protests, and experts note a significant level of resistance and mistrust around testing on the continent. Well, Africa 54 health correspondent Lino Mudu spoke with Dr. Bartholomew Dickey Akinmori. He's a regional advisor for regulations of vaccines with the World Health Organization's Regional Office for Africa and also in charge of the Secretariat of the Africa Vaccine Regulatory Forum. They spoke about the importance for Africa to participate in clinical trials.
Why is it important for the African continent to participate in the global search for new therapies? Why is it important for clinical trials to also happen on the African continent?
When clinical trials take place, they take place in a country, in a population, that the product is actually being evaluated within that population. Now, if Africans leave themselves, stay out of the evaluation of products, then these products don't actually get tested in African populations within African settings or context. And that then means that when the product is eventually introduced, we may never know about events that could arise in special populations within the continent who may not be the same as populations elsewhere where the product was evaluated clinically. So it's important for us to participate in these studies so that at the end, the product which is licensed would be one that is suitable for our use without giving us any adverse events.
What is your message to those who are still skeptical, remembering cases where, for example, in 2005, there was an HIV trial of tenofovir that was highly criticized for reasons such as ethics and safety? There are other examples as well.
As you rightly pointed out, history has bad examples of research, and it's not just on our continent, it's actually global in other countries as well. We've had in the United States of America, there were studies many years ago which also violated the rights of research subjects, where research was not properly conducted, where research participants were not given the care they required. And indeed, in some cases, some harm was done to research participants.
Tuskegee experiment, for example.
Yes. Now, in Africa, the systems are in place to safeguard and protect the rights of research subjects. That the expertise is available, the infrastructure is in place, and that there are also legally established institutions that look over research. People should feel more confident about participating in research.
How can the trust be rebuilt, given how much mistrust there is around clinical trials as well as vaccines?
We need to continue to educate people, we need to reach out to people, let them understand that health products save lives. Vaccines save millions of lives every day. And vaccines have to be developed for diseases as we get, new diseases coming up. And there's a need to be involved in the development process, because the vaccine that we help develop today may be the vaccine that will save your own relatives, family, friends
Now, for those who are looking forward to the vaccine, there have been some concerns about the accessibility and affordability of a COVID-19 vaccine to Africa when it becomes available. What is being done to ensure that African countries are not at the end of the line for access to the vaccine when it's released?
There is actually a framework for accessibility and allocation of vaccines, which has been developed by WHO. And this covers all the essential considerations in terms of who are the vulnerable populations who need to get vaccines first, health to protect health workers and make sure that we secure our health systems. But it's going to also take a lot of advocacy, a call to make sure that there is access to people who may not have the resources to purchase these vaccines. And we in Africa belong to that category. And I think that the African leaders have called for this. The regional director of the World Health Organization, the regional office in Africa has called for this. And all over the world, the European Union and other countries have also added their voice to making sure that there is equitable access to vaccines.
Well, that was Africa 54's Lenore Mudu speaking with Dr. Bartholomew Dike Akindmori, Regional Advisor for Regulations of Vaccines with the World Health Organization's Regional Office for Africa. Well, the COVID-19 outbreak underscores the high risk countries face if populations are unable to access available services, as well as the need for stronger health systems. A progress report by the World Health Organization Africa region on the performance of health systems found that member states in the region have gaps in different capacities, including in poor physical and financial access to services and low resilience of health systems. Well, now, a Nigerian company aims to help improve healthcare services and delivery systems in the country and beyond. Flying Doctors, a Nigerian limited, is a medical emergency service that specializes in air ambulance and remote site medical solutions, among other things. Africa 54 health correspondent Lenore Mudu spoke with Dr. Ola Brown, founder of Flying Doctors Nigeria, to discuss the company's mission and the impact of COVID-19.
So we started as an air ambulance service, but even before we did our first air ambulance flights, we had already opened 2 clinics in different areas of Nigeria. And now we're sort of an integrated healthcare company with our own clinics, with investments in diagnostic centers, with investments in retail pharmacy, with investments in drug manufacturing, in biotechnology, in telemedicine. So we've gone from doing, just one area of healthcare to operating across the entire healthcare value chain. And of course, our mission has changed as well into a more integrative approach to healthcare in Africa, looking to provide healthcare to some of the, underserved populations across the continent, and making sure ultimately that every African can have access to healthcare that is affordable, that is accessible, and is acceptable, regardless of their socioeconomic status.
What kind of role has your ambulance air service playing, whether it's with COVID-19 or just in general? I know you explained a little bit how you have integrated the approach in your service delivery.
So in terms of our operational company as a Flying Doctors investment company, we've been around the country. We set up 8 different testing centers in 8 different states. Some of the busiest testing centers in the country, and we've been actively involved in testing. We've also been involved in setting up the YPO Isolation Center with my business group, Young Presidents Organization here in Lagos, one of the busy centers in Lagos. And then we set up one in another state called River State as well. So we've done 2 isolation centers now. We've been delivering equipment through our logistics investment across the country, including delivering oxygen. We developed a booth for testing, a non-contact booth. So even across our 8 states, with the capability of doing 200 tests per day on each booth, none of the sample takers has contracted COVID-19 because obviously we designed the booths to make sure that there's a barrier in between the tester and the patient. There's an important role for advocacy. There's an important role for continuous education. There's an important role for people continuing to be vigilant, and organizations like ours are also at the forefront of advocacy. But I think that we do need this continuous education and advocacy more than ever, so people have it at the top of their minds that COVID is real.
What do you see are some of the lessons learned from this COVID-19 pandemic?
I think the biggest lesson learned, and I think that this is a global lesson, is that a healthcare problem anywhere is a healthcare problem everywhere. And I think that we'll be seeing a lot more investment on the continent in Africa because, I think the world has realized that we're only as safe as our weakest link. And a problem in Nigeria, a problem in Congo, a problem in Sudan can become a global problem really, really quickly. So strengthening global healthcare systems is perhaps something that we never thought about, and definitely in America, in Europe, I think it wasn't seen as their problem, a weak healthcare infrastructure in Africa, but I think more and more people are realizing the importance of having very strong global healthcare infrastructure. So I think that that's probably the first lesson learned. I think also the role of prevention, I think is really important. So the role of public health. Our healthcare systems have typically been geared towards treating patients once they're ill, but not necessarily as much money has gone into preventing outbreaks and preventing illness in the first place. And I think that this has shone the spotlight on preventative care. I think also the way that we spend our time has changed. I think we've all been through this traumatic period together as a global community, and I think that we've come out a lot stronger because of it, a lot more contemplative, a lot more introspective, and with a lot more perspective on family, on friends, on relationships.
Well, Dr. Ola Brown announced recently that Flying Doctors Healthcare Investment Company is set to raise a $1 billion fund for the purpose of healthcare investment across Africa. Herbal remedies have long been used to treat infections and viruses such as the common cold and fever. In the fight against the coronavirus, Chinese herbal medicine is being encouraged by health authorities in China for the care and support of patients with COVID-19. That's in addition to conventional medical treatment. Well, in Africa, Madagascar's herbal drink, COVID Organics, claimed by the country's president to treat COVID-19, has triggered a debate about the safety and efficacy of herbal medicine. Well, health experts warn there is not enough data to support the use of herbal remedies for coronavirus. Africa 54's Lena Omudu spoke to Amena Gurib-Fakim, former president of Mauritius and biodiversity scientist. They talked about the challenges and opportunities of African herbal traditional medicine.
Let's talk about something else that you're very passionate about, which is digging into Africa's herbs to find potential cures and medicine. Talk to us about this passion of yours and why it is important to look into African traditional herbs, especially with an experience that we are all witnessing when we look at what's happening with Madagascar and COVID Organics resorting to Artemisia. What role African herbs can play in the big picture of medicine, or in particular with COVID-19?
You know, up until 1945, the Second World War, the entire world, we were being treated with herbs. Why I mentioned the milestone of 1945, this is when we got the antibiotics. We started with penicillin, and since then we have gone all the way into synthetic medications. So what happened is that as the years went by, we have started marginalizing the herbal medicine because we have focused mainly on synthetic antibiotic and all the rest of it. Now, at the end of the day, the scientists proposing these new cures as modern medicine, they still have to go back to nature to look for that single molecule. Now, if you look at the contribution of the entire world, the developing world to the world of medicine, we find that They have made phenomenal contribution, but Africa is still lagging behind. And I put this down to two main reasons. First reason is that we haven't really documented our own traditional knowledge, because the documentation, or rather the transmission in Africa, has been oral. And every time an elderly passes on, we have lost a library. Now, to come back again to the artemisinin, in 2003, when they had SARS, it has been reported in the literature that to treat SARS, extracts of artemisinin had been used for the treatment of SARS, and SARS is a corona. So now we have another coronavirus. So I could extrapolate from there that there may be something in this Artemisia annua, which gives artemisinin, which grows in Madagascar, that is providing solutions. But of course, we don't know, because the tests are ongoing for COVID, for the Tamba of CVO, as the president calls it. But it is critical that we safeguard not just the biodiversity, the plants, but also the traditional knowledge that goes with it. And this has been part of my work as a researcher, is to document precisely these traditional knowledge, and I have published the database, which is now in the public domain.
It begs the question, do herbal and traditional medicine undergo the same rigorous process as conventional medicine?
When we develop a medicine, modern medicine for a plant, usually we take the plant, we take the extract, we isolate the one molecule. And this is the silver bullet, which actually goes into the formulation of the drug. But increasingly, for herbal medicine, we adopt what is known as reverse mycology, that we observe what is happening on the ground, and then we take the recipe and we test it in the lab. And this is what is the procedure which is accepted and acceptable for herbal medicine, because, as I said, they have been used. I think this is the approach that the Chinese are doing, and they're doing it so well, because China has given the same status as allopathic medicine to Chinese herbal medicine. Now, why it's important, again, to add value to this traditional knowledge? Because A, they give new molecule for medicine, and B, they are an accepted and acceptable form, which we have taken for so many years by our grandmothers have been giving us these recipes, and it is socially and is culturally accepted to be treated by herbal medicine. So I think the procedure are different.
What will it take for African traditional medicine to get recognition and respect, if you will, that Chinese medicine receive at the international level?
We start with ourselves. We start recognizing, we start accepting our own heritage. We start accepting our own traditions. We start accepting our own medicine as has been given to us by our grandmothers, and which work. And in fact, if you look at even WHO figures, they will tell you that 80% of the world's population still depend on herbal medicine for their primary health care. Now, if you look at it from the economic point of view, it's a huge business which can emerge out of this, because not only is it cheap, it's accessible, it's affordable, and I will add further, it works.
Well, that was Africa 54's health correspondent Lino Madu speaking with Amina Gurib-Fakim, former president of Mauritius and a biodiversity scientist. A new research published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism found that 80% of 216 COVID-19 patients at the University Hospital in Spain had vitamin D deficiency. Men had lower vitamin D levels than women. COVID-19 patients with lower vitamin D levels also had raised serum levels of inflammatory markers. Now, in another research by Northwestern University, scientists analyzed data from 10 countries and found patients with severe vitamin D deficiencies were twice as likely to suffer complications from COVID. For more on the importance of vitamin D and the coronavirus, Africa 54 health correspondent Lino Madu spoke with Dr. Ken Wright-Cross.
As we're dealing with this pandemic, there's some things we have to recognize that have really come out of this, and it's the vitamin D story that hasn't really truly been told. And the coronavirus has allowed us to really set up a platform for vitamin D and why it's so important.
What is it about vitamin D that is so critical during this time of coronavirus?
Okay, so let's look at some of the disease states that we see that the coronavirus preys on certain patients. It tends to be lung disease, heart disease, obesity, and also diabetes. All four typically run rampant in the African American community and the Latino community in particular. And then you marry that with the fact, Lenore, that almost about 80% of African Americans and really worldwide are low in vitamin D, almost 80% of us. So what is kind of going on there? Well, one thing, everybody, is vitamin D is not particularly plentiful in our diets naturally. Things like milk and creams and butter, it's fortified, meaning that it's added. The other thing is when you see our brown skin, you have to recognize that the melanin blocks out the rays of the sun as well, which is the reason why we're so low. And I should say a third thing is that we're all stuck in this house. We're all stuck in this studio. We're not going out and getting the sun's rays. So therefore, everybody, we have to supplement our vitamin D. So if there's one message that I can get out, Lenore, worldwide, is that I want you to know your vitamin D levels. As I always joke with patients, I say, get on my level, which is between 40 and 60. So
is there a way we can tell? Are there some telltale signs that we don't have enough vitamins?
with vitamin D, it's interesting because a lot of my patients who are low in vitamin D, Lenore, they'll just have this sense of fatigue. And when their levels get back up, they always talk about this sense of well-being. Vitamin D is important for so many things. It's not just bone health, but it's also brain health, heart health. When I talk about vitamin D, don't forget, it's the importance of what vitamin D does for our immune system. It's not a treatment for the coronavirus, but it's the support of that immune system because you can't test your immune system, but you can test your vitamin D level and see exactly where you are. I also talk to patients about magnesium sometimes as well because magnesium is incredibly important to also make sure that vitamin D is absorbed properly and also help with the sleep and the immune system and for energy.
But what about other ways that can help support, whether we take supplement or not? What other ways can we get vitamins? I know you talked about the sun. Other things in terms of nutrition maybe we should reinforce?
Look, I'm not a fan of medications if we don't need them, or pills. So the only reason why I'm mentioning vitamin D and supplementation in this case, thank God it's inexpensive. But the other reason why I'm mentioning it is because it's kind of hard to get out of our diet. When you think about it, some of the things that are rich in vitamin D, fatty fish, such as sardines and salmon, you could get a little bit out of that, but not always enough daily to get you to that level. People will say milk. Well, Lenore, it's added to milk. Vitamin D is not naturally there. So I say this, everyone, because it's kind of tough to get vitamin D naturally. Now, you can go out in the sun and get a little bit of sunlight as well. But once again, we're talking about the daily benefits of this. So as we're looking at the best way to get the biggest benefits with vitamin D, and the reason why I wanted to make it a challenge is that I want everyone to know what their levels are, get the levels right. There's nothing better than a natural alternative, I feel, to get well and stay well.
Dr. Ken Redcross, thank you so much for joining us today.
Thanks, everyone. Stay well and stay blessed.
Experts caution that more research needs to be done regarding the effect of vitamin D on COVID-19. Well, and that's our show for today. Be sure to watch Africa 54 on our website, voaafrica.com. From all of us in Washington, thanks for watching.